space where beauty meets authenticity and transformation is not just a possibility, but a promise. I'm absolutely thrilled to introduce you to someone truly special, Dr. Rukmini Vinaya Rednam, the compassionate force behind the countless remarkable transformations in the vibrant city of Houston, Texas. Picture this: every curve, every contour crafted with care and expertise, not just by a board-certified plastic surgeon, but your very own cheerleader for self-discovery and confidence. Get ready to embark on a journey where we explore the art of science of feeling your very best self. This isn't just a podcast. It's your cozy corner of empowerment and inspiration. So pull up a chair, pour yourself a cup of kindness, and let's dive into the Confidence Doc podcast with Dr. Rukmini Vinaya Rednam.
Bienvenidos al Confidence Doctor podcast.
Yes.
As you can see, we are going to be doing a podcast today that is going to be a bilingual podcast. I do apologize that my Spanish is a work in progress, but I have with me today Mayra Gamboa, who is a wonderful bilingual nurse injector, and she's going to be discussing with us today a little bit in Spanish, a little bit in English for any of our bilingual listeners today. So Mayra, tell our audience a little bit about yourself.
Hi, everyone. My name is Mayra Gamboa. I have been a nurse for 8 years now. I've been doing aesthetic work for 3 years, and I'm obsessed with it. I definitely enjoy boosting my patients' confidence, working on patient balancing, enhancing their beauty, just seeing their happiness once I'm done with their treatment. It really fills me with joy.
And for our Spanish listeners, will you kind of say exactly what you said to them?
Hola a todos, mi nombre es Mayra Gamboa, soy enfermera registrada, llevo practicando hace 8 años y hace 3 años me enamoré de la medicina estética. Me encanta, me fascina que la gente se sienta muy linda después de los tratamientos que les hago y realmente que me llena el corazón de mucha alegría.
So Mayra, right now, there's been a lot going around about med spas in general, right? Like people have a little bit of anxiety about it because every time you look at the news, there's something going on, like counterfeit Botox or somebody getting, infections from things. Med spas are regulated and can be done properly, right? So when you decided to go into this aesthetic field, what kind of training did you get so that you know that you were providing the best quality care for your patients?
So initially, as I mentioned before, I'm a registered nurse. After I decided to transition from bedside nursing to aesthetic nursing, I got certified. I got certified in neurotoxins, thermofillers, and continue to advance my skills. I went out of the country to even train even more. And then every single month, I try to either do videos or actually in hands-on trainings. So it's like, you got to stay on top of your stuff. You can't just trust anyone that you Google on Groupon or anything. It's not safe.
Yeah.
I would say I would highly recommend for people to look into doing these treatments with a nurse, an NP or an MD, just because we know our anatomy, we know what we're doing, and it's just safety.
And I think you hit it on the nail when you said you're continually learning.
Yes.
If you take a course and you think you're done, like there are unfortunately these weekend courses, I'm going to learn everything. No, you constantly have to be learning to be able to provide the best care.
Yeah. And you can never know it all. So
that's true. That's true. So of the type of procedures you perform, what is your favorite procedure?
So I love facial balancing. I love assessing my patient's face and just kind of seeing how I can improve their face. Enhancing their beauty. Cheeks are a main thing for me. I just feel like it targets everything. It gives you a lift. It can essentially lift your nasolabial folds and also kind of blend that under eye hollowness that a lot of patients do have. And now in Spanish, because we forgot. El procedimiento, como decía antes, que me encanta el balance facial. Me encanta analizar la cara de mis pacientes y ver cómo les puedo ayudar a que se vean mucho más bonitas, mucho más bonitos. Pómulos es una de las partes que me encanta hacer. Creo que es buenísimo para levantar el rostro, ayudar con las líneas de expresión y también con las ojeras, que muchos de mis pacientes lo tienen. Y volviendo al tema de cómo saber a quién puedes escoger para tus tratamientos, creo que es muy importante que las personas busquen a una persona que sea licenciada, sea doctora, enfermera o NP, para que no tengan ningún problema de que no sepan su anatomía de la cara, que no tengan la educación suficiente para evitar cualquier problema o algún error médico.
When you approach each one of your patients, if you're doing something like facial balancing, do you feel like you have some sort of a pattern that you look for, or do you kind of, is every person an individual?
I think everyone's unique. I don't generalize my assessment. I initially have them talk to me, tell me like what's bothering you or what do you want to work on, right? I give them a mirror and then we'll go from, top to bottom and kind of address concerns. Then from there, I create a plan of care to target what they're needing. And then if they're, from there, I go and I give them my advice like, hey, you're coming in for wrinkles, but then I can help you hydrate your skin with, skin beads per day. It's targeted. It's very unique to each patient.
Now for Spanish
En
speakers.
español. Cuando cada vez que veo un paciente lo analizo como una persona única, el tratamiento es para cada persona. La persona llega, hacemos una analización de cabeza al cuello para ver cuáles son sus problemas. Yo creo un plan de cuidado para ellos y basado en eso, yo doy mi opinión si considero que otra cosa les podría ayudar. Por lo menos si una persona viene para un problema de arrugas y tiene la piel muy seca, yo les puedo considerar que usen Skin Bead, que es un nuevo producto que ayuda a hidratar el tejido.
What are some things that you think are kind of things people should stay away from when it comes to med spas? Like things that maybe sound enticing and sound like they could fix all, but are just not a good idea.
Med spas that are cheap are a red flag. I've known of med spas who promote Botox and they're not actually injecting Botox. So I wouldn't base picking a med spa just on cells. Again, do your research, prestige med spas, making sure that they have a great medical director like Dr. Rednam and great staff that actually has done their education and worked on their skills for a while now.
And definitely in español, because that's
En español.
Sí.
Sí. Yo considero que cuando una persona está eligiendo buscar un tratamiento en un med spa, no se tiene que enfocar mucho en los precios. Hay muchos lugares donde el Botox lo venden mucho más barato y realmente no están inyectando Botox. Considero que las personas tienen que buscar un lugar de prestigio como el med spa que tenemos nosotros aquí, My Evergreen Med Spa, con una doctora especializada en todo lo que tiene que ver con la cirugía plástica, con gente avanzada en sus estudios y bueno, con gente licenciada como yo, que soy enfermera registrada.
And I may be biased with this, but it's truly, I feel that your medical director should be somebody who is in aesthetics. So I do think it's a red flag if you find out the medical director is a family practice doctor or gastroenterologist. And it's not to say that they're not excellent in their field, but that's the person that your staff is relying on if there's an issue or concern or question. And I don't necessarily want that to be somebody who, is taking care of my gut. So I think that is an important point that you made as well.
Yeah, and I do agree. I love the fact that you do know how to do injectables yourself and that if I have any questions, I can always rely to, with your background and all your knowledge. So I definitely think that's a great thing.
So I think being in Houston and having a very large Hispanic community here, I love that we have such a talented Hispanic injector. What would you feel in that community? And I know you don't speak for everybody in the Hispanic community, but that you feel is some of the concerns that specific to that community, or maybe even things that people are anxious about when they think about injectables or skincare.
So I do feel like there's kind of this mentality of, okay, if I get filler, my face is going to look completely different. I think people need to get in the habit of like, if you have the right injector, we are going to guide you to look yourself, but better. Okay. The overfilled look is not in anymore. And I do feel like a lot of moms, Hispanic moms, they watch their novelas and they feel like, oh my God, she looks overdone, or even like Hollywood stars, again, finding the right provider will take you to be successful in your aesthetic goals. Yeah. En español.
Sí.
Creo que el mito es un mito muy latino realmente de que las personas que se inyectan ácido hialurónico se van a ver totalmente transformadas. Ese no es el caso. Si tienes una persona que te sabe guiar, que sabe analizar tu rostro y que te va a llevar a verte mucho mejor y no transformar tu rostro. Con el ácido hialurónico se pueden hacer cosas muy bellas y no necesariamente el rostro de las personas tienen que cambiar.
And I love that, right? Like, I think that aesthetic procedures can be for anyone, right? I think that there are a lot of women of color who get really nervous because they're not sure the procedures for them, but that's not the case, right?
Yeah.
And I love that in our spa, we have so much diversity within our own staff, and we are able to help people guide with not only really well trained staff, but we also have a lot of ladies who are like, I understand. I have a whole nother level of understanding.
Yeah.
So, what's something you hate performing? Or maybe not hate, that's a strong word. What's something that's maybe not your favorite thing to perform that is commonly performed in a med spa? It's okay if you don't have any.
Let me.
I caught you off guard with that.
Yeah, I'm thinking. I'm gonna say hate. I think educating my patients not to overdo things. I do get a lot of patients that are wanting to overfill their lips.
Like it's a challenge. It's a challenge, right?
Yes. So I guess learning to say no. Or the ones that like are pushy and they just won't listen to you.
Yeah. And I think that is hard because at the end of the day, you're trying to guide them and you want to make sure that you are presenting them with the best possible result.
Mm-hmm.
And it is hard because obviously social media plays a big part in this, right?
Yeah.
Somebody sees somebody else had something and we may not know like if they were just injected or if they're weeks out. And so it's hard. And I think it's important that people really work not to compare themselves.
Definitely.
Just because maybe it took 2 syringes for somebody else, but it really only needs a syringe for you.
Yeah. That's where I'm coming from. So yeah, I don't like overfilling anyone, and if someone doesn't agree with me, then it's okay. I'm just trying to guide you to have your best outcome.
Correct.
Sure.
And that's what you should want from
Yeah.
your injector. You should want an injector who's
sure.
looking out for you, who's not like, sure, let's put some more in.
Yeah. It's not just a cell. It's actually helping you look better, right? Yeah.
So how do you handle the person that goes, I want 1 syringe of filler and fix it all?
Oh, that's another one. I'm like, no, there's no way. 1 syringe is just gonna do your lips. So just think about that. 1, that you need like a few more than just 1 for your full face. Yeah, you always have to let them know this is what you're gonna need. And even then, they might want to come back in 6 months, 9 months, and just do a touch up with more filler.
And since that's such an important one, I definitely want you to say that in Espanol.
Bueno, la doctora me pregunta que cuáles son las cosas que considero que son como un poquito difíciles en la industria. Las personas que se quieren poner mucho ácido hialurónico o las personas que creen que con una sola jeringa se pueden corregir todo el rostro, ese no es el caso. Una jeringa de ácido hialurónico simplemente te corrige los labios. Para hacerte los pómulos, el mentón, usualmente son de 3 a 4 jeringas y de 6 a 9 meses si le decimos a los pacientes que vuelvan para hacerlos un retoque. Pero sí, esas serían las cosas que considero que es muy importante que las personas sepan, que ni una sola jeringa va a arreglar eso del rostro y que no necesitan ponerse más de lo que necesitan en la cara.
And very well said. But one thing I will ask you is, when we talk about facial balancing, we're usually talking about multiple syringes, just like you were saying. So do you think that your age, as you get older, are you requiring more syringes, or do you feel like that number doesn't change? It might just, the type of quality, the type of filler might change. So how do you kind of decide like, okay, this is how many syringes of filler I think somebody needs in their 20s versus 30s versus 40s?
So I feel like quality of life, you can see it in patients, right? So if they're older, but they're fitted, and they're taking care of themselves, that also has a lot to do with like how I'm going to approach their facial balancing. It changes, it varies. Yes, as we age, obviously we lose more volume. You might need more filler, definitely. Not per se that one is going to need 9 because you're 50 and the other one's going to need, 10 because you're 20. No, again, it's based on patients' volume lost. We can either target it with biostimulators like Sculptra and filler. So to answer your question, it just varies based on the patient's needs. If there's a lot of heavy tissue, we might want to do threads, right? Mm-hmm. Or we can do skin tightening with lasers. So it just depends on patient's needs. But essentially, you are not going to get correction with 1 syringe, at least 5 syringes for facial balancing.
So we talked a lot about volume replacement, and you brought up a good point. What happens when you have somebody who actually maybe has the volume, but it's actually drooping? They're not quite ready for surgery. So then what are their options to treat that volume change, but without necessarily having to go to surgery at this point?
Yeah. So I like to be honest with my patients. If they're not wanting surgery, we can essentially talk about PDO threads. They're great for lifting, and it's not a surgical like facelift, but it is kind of an intro of what you can expect from it, correct? Skin tightening with lasers, lifting with threads. We can do biostimulators to create collagen and just kind of firm that tissue to pull back Filler is great. We can do a liquid lift, what we call it, with filler. And once I see that the patients are in need of surgery, I will be honest and refer them to you.
Yeah. And that's the thing is some people may never want surgery, right? But then there are other people who are really happy just to have smaller changes. And I think what you've said before is you have to individualize it. So any place that sometimes like people call me like, how much is this for this one thing? Well, it has to be individualized because maybe you don't need the whole blue plate special.
Yeah.
You just need a little bit. So I think by listening, that's the key with everything is by listening to the person sitting in your chair, you're going to be able to tailor exactly what they need.
Yeah. And we can do it in different appointments. We can do a consult, do a few treatments at the beginning, and then just kind of build on it. We don't necessarily have to do all the treatments in one setting. We can always build it up and slowly
try to explain to our audience how PDO threads work and like how long they last? Because there's a lot of information out there. Some people love them, some people hate them. So what's your take on it?
So PDO threads are essentially meant for lifting the tissue underneath the skin, of course. It is a treatment that it's going to help lift the mid-face and lower face. It's meant to last 9 to 12 months. With that being said, I do have my patients come back in 6 months. And if we're needing to add more, we can always add more. It gives you a good lift. It varies per patient. If you have more laxity of skin, you're going to need more threads versus someone who doesn't need as much, correct? I've loved the results I've seen in my patients. I haven't had issues, God forbid, with any of them. But again, if it's a surgical patient, then I'll refer them to you. Aside from that, I have seen great results with threads. There are surgical threads. They have bars. They go underneath the tissue, lift your tissue, create collagen. And that collagen firms the tissue and gives you more of a lift. So again, they're meant to last 9 to 12 months. And then with that being said, they can do touch-ups between the time.
Por favor, en español.
En español, sí. Los hilos tensores están hechos para durar de 9 a 12 meses. Es un hilo quirúrgico que se pone en el tejido y levanta la elasticidad de la piel. Dependiendo de qué tan caído es el tejido, varía el número de hilos que se necesite. Algunas personas van a necesitar cirugía, pero hay unas que no están listas para hacerse cirugía. Entonces, el hilo es especial para levantar la parte media de la cara y la parte baja de la cara. A 9 a 12 meses, los pacientes pueden volver y podemos agregar muchos más hilos, dependiendo de qué es lo que quieran obtener.
So for someone who's seriously thinking about threads, like what's the comfort level when you're having this done? Because for some people, they hear that and they're like, you're putting threads under my skin. Is this going to hurt a lot? Like, how do you make someone comfortable during the procedure?
So we have products here, which is known as laughing gas. That is one of the things that I offer. Yeah. It gives you that, it relaxes you. It gives you kind of high and then you just kind of relax yourself. I also do topical lidocaine and then subcutaneous lidocaine. So injected, topical and injected lidocaine. And then as I'm pushing the bar, which is with the cannula, I'm also injecting lidocaine. So my patients rated as a 5 out of 10.
5 out of 10.
Yeah. 10 out of 5. 5 out of 10 as pain level. Which is not that.
And at the end of the day, there's always a little bit of pain involved with beauty.
Well, beauty is pain. Beauty is pain. So yeah. But I think it's worth it. It's worth the pain. Like anything, like surgery, right?
Yeah, just like anything.
If you want to look better, you gotta suck it up.
So I agree with you. Like I said, threads can be controversial, but I think that when someone's skilled in them and you're setting realistic expectations, that I think that it actually can provide. And I've had some patients as well who've been really happy with what their result is because their expectation was realistic for what it could provide. Threads do go away with time, so they're similar to suture material that we use in surgery. And so while yes, it is going to stimulate some collagen formation, that means some tissue there overall, as long as they are not permanent threads, I think that there still is definitely a place for them.
Yeah, definitely. And again, yes, like you said, they're going to dissolve and they're just going to stay with that, give you that extra boost of collagen.
Will you explain, you talked a little bit earlier that you offer PR EasyGel. So could you explain what that is?
So EasyGel is essentially our plasma. We heat it up and convert it into a gel. The gel is amazing to target areas, especially for those patients who are afraid of filler. We can target temples, under eye, cheeks, nasolabial folds, and then lower face. So we also have what we call EasyGel facial balancing. The gel itself is going to be as thick as certain fillers that we have, such as Volbella, and not as thick as Voluma, but it is a medium G prime filler. per se, EasyGel, actually. It's not filler. And it is great. It's a biostimulator. It gives you that extra boost as well, collagen. It rejuvenates the skin, and it's great for people of all ages.
And it's a nice option too, right? If somebody's really anxious about how they might react to it, it's made from
It's
that.
natural.
It's about as all natural as you can get.
Yeah. Yes. So it's organic.
And then
Organic.
what's the kind of length of time that may work for?
So again, depending on what patients are trying to target, I do suggest for patients to do at least treatments throughout the year to see better results. We can try to target under eye hollowness with one treatment, but they might want to come back in 2 months and we can add some more. So it just depends on the patient's needs, but essentially we'll total 3 treatments will be best.
Okay. ¿En español?
Tenemos a EasyGel. EasyGel es la plasma de nosotros mismos. La ponemos en un procedimiento que calienta la plasma para volverla en una gel. Esta gel se utiliza en la parte de los ojos, en la parte de los pómulos. Sirve como parecido como un ácido hialurónico, pero no es ácido hialurónico. Está hecho de la plasma. Es súper orgánico, súper natural. Una buena opción para las personas que no quieren usar ninguna cosa sintética. Y dura los beneficios de eso duran de 9 a 12 meses. Los tratamientos serían un total de 3 tratamientos usualmente. Se pueden espaciar entre 1 mes a 3 meses, dependiendo de qué área se esté usando. Es muy famoso para debajo de los ojos. Y sí, yo le considero a los pacientes que vuelvan cada 3 meses para que se vuelvan a retocar los ojos.
So when my group decided that we really wanted to start a medical spa, it was because we were like, we're a group of plastic surgeons. We really know the aesthetics, but we really wanted to be able to offer something that from very talented, and it happens to be all women, that would really be something that we're like, gosh, these are experts in their area. And so while we have more than one injector, we also offer lymphatic massage. We also have estheticians. So Mark, can you tell our audience a little bit about everything that we do down there?
Yeah. En nuestro med spa tenemos diferentes servicios, como dijo la doctora, desde masajes linfáticos a inyectables, y también tenemos láser, y tenemos nuestra esthetician que hace faciales. El servicio linfático es para postquirúrgico, ayuda con cualquier tipo de lipo, mommy makeover, todo eso. Los inyectables los ofrecemos nosotros las enfermeras, y tenemos la esthetician que hace los servicios de láser y faciales.
Do we need a now in English?
Okay, so downstairs we offer a variety of services from lymphatic massage to facials, injectables, and IV therapy as well. If anyone has any questions, we're more welcome to, we have answers for all of y'all. Post-surgery, we do have Miss Val, who loves what she does, and she's amazing at what she does.
Absolutely amazing.
So if anybody needed that service, she is there for you.
I have to throw in that we also offer weight management, correct?
Yeah.
And I think that when we decided and made that decision, we wanted to help offer weight management. We wanted to do it very responsibly. And so can you explain kind of what it's like if someone comes in for a consultation? What's the follow-up? Because this is not get your shot and goodbye.
Okay. So we essentially have our patients come in. The first thing we do is get their blood work done. So lab work, making sure that their thyroid is working, that nothing's off range. And then once we get the okay from the doctor, we go ahead and prescribe the medication. We do have patients come back, get their blood work every 3 months to make sure that everything's within range. And we keep open communication with our patients in case they have any questions.
So if somebody's just like terrified of giving themselves an injection, do you guys have an option for them?
Yes, we do. So it's optional. They can come in, we can assist them with the injection, or we can train them to do it themselves. But if they're absolutely afraid of it, we're here to help them.
And that's the benefit of having these amazing nurses working down there. And we keep saying down there because our clinic is on the 3rd floor and they're on the 1st floor.
So come see us.
That's why it's always downstairs. And we're very lucky because while Mayra works mainly up in the Woodlands, she does offer some days at our Spring Valley Memorial City location as well.
Yeah, I'm actually currently offering 2 days. It'll be Saturday, June 15, and then Thursday, June 27 at the Houston location. So if you guys are interested, give us a call. I'll be there on those days.
And every month she'll have 2 days. So if you're hearing this and those days have already passed, that's okay. But we do have a number of really wonderful injectors. I just have a special place in my heart for Mayra because she is so passionate about what she does, and she makes her patients feel so good.
Thank you.
And so and that's what we want. When I, talked why I wanted to bring her on the show is that everybody I work with is hopefully an extension of myself too. And I feel like we all care about our patients, and it sounds easy, but it isn't as easy as people think. You can go certain places and they aren't looking out for you. They aren't thinking about what's the best for you. And that's just not how it is here. We want to think about what's best for you. We will turn you away if we don't think something is in your best interest. And that's what I would want from someone taking care of me.
Yeah, definitely. We genuinely care for our patients. And that's what I love about my Evergreen Med Spa.
En español.
Nosotros ofrecemos un servicio de pérdida de peso para nuestros pacientes. Si alguna persona quisiera una pregunta, estamos más abiertos para hacer la consulta abajo. Como dijo la doctora, estamos en el primer piso, esta está en el tercer piso. Cuando las personas llegan a nuestro servicio, sí les hacemos una orden para hacerse exámenes de sangre, para asegurarnos que la tiroides esté bien y que todos los laboratorios estén correctos antes de darle la prescripción para la medicina. Les aseguramos que los pacientes vuelvan cada mes. Tenemos una conexión con ellos, comunicación abierta todo el tiempo. Cada 3 meses hacemos exámenes de sangre. Y si las personas tienen miedo de ponerse la inyección ellos solos, nosotros les podemos asistir.
Muchas gracias, Mayra, por venir al podcast.
Muchas gracias a ti por tenerme a mí. Eres muy linda.
Tune in next time for our next exciting episode on the Confidence Doc.
As we wrap up another episode of the Confidence Doc, I want to extend our heartfelt thank you for being a part of our community. If today's conversation resonated with you, remember that Dr. Rednam and her team are here to support you on your journey to self-confidence and beauty. Your story is unique, and it's our privilege to help you create the masterpiece that is your life. If you'd like to book a consultation with Dr. Rednam, you can visit her webpage at drrukminirednam.com. Fill out a contact form, and one of her coordinators will get with you accordingly.